This is News at Prime. If you're just joining us, we continue the conversation on the report by UNAIDS on HIV infections, and that report saying that there is a dramatic decline in HIV infections in sub-Saharan Africa, and it means the governments are doing something right. But let's continue the conversation differently this time around. We speak to Wonderful Mabuza. He is a researcher and project manager at Ntirhisano project. They are training traditional healers in rural Mpumalanga to help diagnose HIV. Mr. Mabuza, good evening to you, and thank you very much for your time. Let's begin with what got you started with this project. What sparked your interest in traditional healers now that you are training them to help them diagnose HIV?
Good evening to the listeners. My name is Wonderful Mabuza, as the project manager for research, working for MRC Vets Engine Court. It's a syndicate for Vets Health Consortium, where we started working in the rural area of Engine Court since 1992. We've been doing research in the surrounding communities, rural communities, of course. So what actually came about, there's been discussions in terms of how we can integrate traditional healers into the primary healthcare system. And since 2015, we've had conversations with traditional healers to really find out how they are actually protecting themselves from contracting HIV. We know that our people in rural areas, they trust traditional medicine, they trust traditional healers, and of course they go to traditional healers. We cannot shy away from that. So we found out that a lot of traditional healers are exposed to HIV mainly because of the activities. They perform the incisors where they cut people, and they with bare hands without protection. Hence, we came about with a study. First, it was the study where we were providing them with PPE. We gave them masks and also the gloves. And later on, we then did a feasibility study where now we wanted to see if we can be able to train traditional healers to do or to conduct HIV testing. And also we wanted to see if the clients who go to traditional healers will accept HIV testing if they are offered. And also wanted to create a conducive environment between traditional healers and the biomedical staff, the nurses at the clinics.
Yeah.
And of course, there's data that shows that we have about more than 200,000 traditional healers, which is more than doctors and nurses combined in South Africa, which shows that there's a gap in terms of HIV treatment, because then, of course, there are people who divert from the mainstream or going to the clinics and go to traditional healers mainly because of trust and also because of convenience with the traditional healers. There is a traditional healer next door. So you have a neighbor who's a traditional healer, it's easy to access them more than traveling some distances to a clinic. So that's what actually came about in terms of the discussions prior to implementing the study.
Yeah, you've explained very well the relationship of trust that exists between traditional healers and their clients, and that, many of the people in South Africa tend to go to traditional healers if there is, or they suspect that something could be wrong. But the question I want to ask now has to do with how receptive have traditional healers been to being trained to help diagnose HIV, and subsequent to that, go a step further in saying, take the treatment.
Yeah, so We did not really find any resistance from the traditional healers, mainly based on various reasons. One, uh, we know everyone knows like HIV exists, and they've been seeing clients who are HIV positive, but they were not able to really diagnose because they did not have like test kits to do the testing, and now it was difficult for them. Some clients will die, and they don't want that to happen, because if as a traditional healer you have a client who dies, then it actually affects your reputation, and they wanted to be part of this study because now they will be able to test clients before they offer or give them any traditional medicine, and if they found them to be positive, they are able to refer. And also, they want to be involved in terms of like in the fight for HIV. So there is that zeal for traditional healers to be part of the activities around fighting for HIV in the country. So
Yeah.
we did not really find any resistance. They were very excited to be part of the study.
All right. And perhaps another intriguing question here. How open were the traditional healers to the question about how many of their clients did they lose possibly to HIV/AIDS? Were they open about that? And could that have been the incentive for them to want to get involved here?
Not really to say the numbers, because of course they would not really disclose in terms of who was really positive, because they did not really test that person. However, they were open in terms of like generally the numbers. Like they will say they had a client whom they thought could be potentially HIV positive. However, they did not have resources to do the HIV testing, but they were not really disclosing the numbers, because that, of course, will really affect them as traditional healers in the community.
Yeah. I'm going to press on this, Mr. Mabuza, because this is quite
Yeah.
interesting. So once the traditional healers discovered that their client is HIV positive, how eager are they to recommend the traditional medicine versus the versus the medicine that they would normally get from the clinics or the hospitals?
I think with the client, the traditional that we had, they went through training, extensive training, before they started initiating or offering HIV testing, and they understood various dynamics in terms of the HIV treatment guidelines in South Africa, and of course the need for them to really refer those clients that are found positive to the clinic, so that they get medication other than maybe giving them traditional medicine first, because of course again it was from their experience where maybe they have seen that some of the things that they were giving before really did not assist or help in any way in the cure for whatever ailment that the individual showed. And at this stage now, they really wanted to be part, so they can be able to have that road way of getting into the clinic. Like, as I said, one of the objectives was for us to create that conducive environment where now traditional healers are able to refer to the clinic, and the clinics, they know that there are healers who are testing in the community, and they accept those individuals who come who were tested from the traditional healers.
Very interesting indeed. And your research, is it only focused in Mpumalanga? And how big a traditional healer base would you say you have now, where traditional healers are quite literally embedded within the health system?
So at the moment, we actually were doing a pilot study, which we realized that it is working, where we were just having a smaller scale of only 15 traditional leaders who were tested, who were trained, and now we after that we wrote a grant to actually expand to the entire Bushbuckridge sub-district, which is something that we'll be doing in the next 2-3 months, where now we'll be training about 300 traditional healers in the Bushbuckridge sub-district, and those healers will be linked to 42 clinics in Bushbuckridge. So that's where we are at the moment. And of course, one of the objectives into the bigger grant is looking at cost effectiveness, where we are actually looking at, we're talking sustainability, because a research study comes and goes. Like you do your research, you get your findings, and you present or write papers. And at this stage, we're really looking at sustainability, whereby now the Department of Health will have to take over or has to do some policy change in terms of incorporating traditional leaders into the primary healthcare system. And that will be presented in terms of how much would it cost for this type of intervention to be taken up into other provinces in South Africa.
Very, very important work being done by the Ntirhisano project. They are helping to train traditional healers in rural parts of Mpumalanga to help them diagnose HIV. Wonderful Mabuza, I want to thank you very much for your time, sir.